let's look at an introduction to the body. And the first thing we want to start off with is anatomical position. Anatomical position is a reference used to describe the body, and it has a few characteristics. So this person right here is in anatomical position, and what you notice about him is that he is standing upright, up, and his arms are facing forward. So supination is when your palms are showing up, and pronation is when your palms are facing down. So his arms are supinated. His palms. And he is facing forward. And finally, his feet are flat on the ground and a little bit apart. And they're a little apart, I'm not going to write that. Okay, so if this is a reference point for talking about the body, there are a few terms that come with looking from anatomical position. And one of these terms is superior. And superior means toward the head. So superior. And the most superior part is the top of the head, right? So it means toward the head. And then if there's a superior, there's also an inferior, and that means towards the ground or away from the head. So we can write inferior. Now this is for the main part of the body. But when we look at the limbs, there are different terms, and these are proximal and distal. Proximal is closer to the point of attachment. So your shoulder is proximal and your palm is distal. So proximal. And then this would be distal. Now you can also use proximal and distal for the legs. So the hip would be proximal and the ankle would be distal. All right? And now let's look at body planes. So when you have body planes, you are dividing the body into different ways. And these are often used for x-rays or just in different textbooks. And the first plane we can look at is sagittal, okay? The sagittal plane divides the body into left and right, okay? And notice that I wrote right over here and left over here, and that's going to be flipped because the patient's right is always going to be your left, okay? So the sagittal creates left and right. But there is a special type of sagittal line called the mid-sagittal plane. And the mid-sagittal plane divides the body evenly into left and right. Just imagine that is even, and mid-sagittal is even, okay? And the mid-sagittal plane, because it's even, is also called the midline. And this midline is the exact split down the middle of the body. But with each plane comes different terms. Okay, so towards the midline is called medial. Okay, and then away from the midline would be called lateral, or to the side. Okay, So that's our first plane. And now let's look at another plane. And this is the transverse plane. The transverse plane divides the body into inferior and superior areas. So this is called the transverse plane. And it divides into superior and inferior. At the navel or umbilical region, so this is going to be a little bit up. So if this is the belly button right here, that's where the transverse plane is going to go straight through. All right, and then there's one more plane, and this is called the frontal or coronal plane. And the frontal or coronal plane divides the body into anterior and posterior areas. So let's write coronal / frontal. And it divides into anterior, which is the front of the body, meaning just the whole front. And then there is posterior, meaning the back or the tail end. Now, this is just a broad term. Posterior and anterior are broad terms, but there are even more specific terms known as ventral and dorsal when it comes to the front and back of the body. And dorsal means the back, specifically the spinal column. So you can think of dorsal fins in dolphins, and dorsal is specifically back / spinal. Okay, and then same thing for ventral, except ventral pertains to the front of the body and it means belly side. So if you're saying ventral, it would be right here, and anterior would be everything else. Okay? But it's easy to reference this actually in an animal that's not a human, and that could be a dog. So let's look for a dog picture. If you have a dog, the front of the dog would be anterior right here. And the back of the dog would be posterior. Now the spinal column would be right about here, right? So that would be dorsal. And the belly side of the dog right here would be ventral. And that is it for body terms and directions and planes.